Well, good morning and welcome to Still Up with 6, where the conversation continues here on social media. Of course, we have a lot to get to, but first we want to say good morning to Chris Rogers, who's joining us from home as we enter week 3 of our social distancing and working from home orders. Chris, how's it going over there?
It's going pretty well, Heidi. I know that we're going to wait here for a couple of moments just so more people can join us this morning, but we want to remind you we are here to answer your questions at home. I know that there's a lot of uncertainty right now. We are around this every single day, Heidi and I, so we do have some insight and some answers to some questions that plenty of you have at home. I know that there's a lot of questions about the numbers right now, so Heidi, if you want to kick things off with the latest numbers across Central Texas, and then we can kind of get into some more details about Verify, our talker of the day, and some different policies being put in place across Texas. Well,
I'll tell you, over the weekend, Brazos County saw the largest uptick in cases. They got 19 new cases over the weekend, bringing the total to 94. Bell County's at 58 cases. McLennan County is up to 53 cases now. And a 4th case has been reported in Copper's Cove. Meanwhile, Coryell County has 6 reported cases in total. So, yeah, the numbers are growing, and something really to note coming from the White House yesterday. Top health officials are warning the next 2 weeks will be the worst of the pandemic as we near that peak of this whole thing. So that's something to keep in mind. Also, the U.S. reporting 9,600 deaths. So the numbers are growing at a rapid rate, and just hearing top health officials say to brace ourselves for the next 2 weeks is kind of scary as we enter that period. We knew we were going to reach the peak, though. We knew that this was inevitable. The peak was yet to come, and it's on the way, and it's going to be coming in the next 2 weeks.
Yeah, Heidi, the Surgeon General calling it many Americans 9/11 moment, many Americans Pearl Harbor moment. This next week is going to be very, very difficult. There is going to be a lot of tough news coming out. There are going to be more deaths. There are going to be more cases. There are going to be millions of more people that lose their jobs. And it's important that we stick together, that we follow the guidelines that are put in place by top health officials in the White House. It's so important that we're following our county guidelines. But we want to remind you that this has to get worse before it gets better. And this week, very well, could be the most difficult week in many of our lives.
And Chris, I know you're getting a lot of questions. I saw that you worked over the weekend to verify some claims during our weekend evening newscast. What did you verify this morning for people? I know you verified a number of different claims and things that are being spread online. Can you go ahead and run us through those?
Yeah, Heidi, so a big question that I got since Verify a short while ago about child support. People would contact me and they laid out their individual situations with their ex, the father of their child, and they asked about if that would affect their spousal payment or if that would affect their stimulus check. And here's what I can tell you this morning. If you are owed child support, the good news is that the person who owes you child support most likely will not be receiving a stimulus check, or at least the majority of their stimulus check. That money will be then diverted to you. As for the stimulus check that you will be receiving, if you are eligible for it, it has no effect on that whatsoever. So the people that will not be receiving a stimulus check inside the salary cap are only people who owe back child support.
And of course, Chris is doing the best he can. He is a one-man band doing all of the research himself. So continue sending in your questions, but be patient with him. I know you got some people asking for the answer to their questions, but yeah, you can only get to so many at a time. So thank you for that. Let's take a look at the comments now. Gladys is saying, some are saying that Texas will be the new hotspot of the virus. Thoughts on this? Yes, there are reports that Houston might be the next hotspot for this pandemic, which is why people really need to practice social distancing and staying home. And of course, now all of the states are being urged to put shelter-in-place orders. Of course, Governor Greg Abbott still hasn't issued one for the state of Texas. Arkansas hasn't either. So that's another thing that is being called on by health officials and leaders.
Yeah, absolutely. So, I mean, this is something that very well we know. We have high urban areas, dense urban areas. So it's certainly a real possibility, Gladys. Of course, we don't like to speculate, but certainly a real possibility. Carrie commenting, this is something I saw a few minutes ago, worth checking out. It says there's a scientist at Harvard who made the coronavirus and sold it to China. What is this world coming to? So this is referring to Harvard professor Charles Lieber, the rumor that he sold coronavirus and was arrested for it. I can tell you this, that's a mostly false claim. What I can tell you is this man was arrested back in January, but he was arrested for misleading federal authorities. Now, it had nothing to do with developing the virus, nor was it developed or manufactured by anyone in China. Now, what he did do is mislead federal authorities about his connections in China, so that much is true. He was arrested for that, but as for the claims that he sold and developed a virus and sold it to China, that is absolutely false.
Terry weighing in saying, how do they know when the peak is and the next 2 weeks are going to be the worst? That's a good question, but we have to remember there is the task force. It's a number of doctors, a number of researchers, a number of people working, and of course they're looking at the numbers, and they're looking at the number of cases on a daily basis and how that's growing rapidly, and I think they're able to predict when the peak of the pandemic will be.
Yeah, Heidi, and what these are based off of are models. Typically, the projections are based off of very detailed models and a number of different models. Now, the advantage we have here in the United States, of course, is that we've seen how this develops in other countries. We've watched it develop in China, certainly. We've watched things get bad in Italy as well. So the top officials are taking those numbers, scaling them to the size of the United States, taking into consideration the growth and the number of new cases every single day, and that's how they're able to project when the worst is going to be and when the peak is expected to hit. So, of course, these are all still projections, but they are based on a great deal of resources and information.
And Thomas is saying, thank you, Chris. Fake stories make this harder. Yeah, I think when we're seeing these fake claims circulate online, it's very easy to believe them, right? Especially as we have so many questions and there's so many unanswered questions when it comes to this pandemic, its spread, if there's going to ever be a vaccine. So I do think that just send in your questions if you have them before you share them online if you're unsure about them.
Yeah, and we've got people commenting about being developed in the lab. I know there's been a lot of speculation online that the government has a patent to the coronavirus. And I can tell you why that's misleading. We want to remind you, the coronavirus is not new. What is new is COVID-19. The coronavirus has manifested itself in many different ways, right? We know that SARS was a form of the coronavirus. So is there patents to the coronavirus in order to develop vaccines to certain strains? Yes, absolutely. But there is not a patent to COVID-19, nor was this known about before it hit. We've got people multiple times a day, Heidi, sending me emails with pictures of the back of their Lysol cans, and it says, it can help fight the coronavirus. And they're saying, well, how did they know about this? How did they know the coronavirus existed? We do want to remind people that the coronavirus is not new. COVID-19 is new, and that is why you'll see some of these claims.
It's just like the flu. When we have different strains of the flu each year, that's a good comparison to what coronavirus is and what COVID-19 is, and why coronavirus is a known thing versus COVID-19 being the new strain of coronavirus. So that's a good thing to know. We do also want to say this was actually a big, huge story online yesterday. The first tiger has tested positive at the Bronx Zoo. It's a 4-year-old tiger, and a couple of other tigers now being monitored for their symptoms as well. And this was new, Chris, because you had verified that animals couldn't get the coronavirus, right? Because we hadn't seen any test positive.
Right. So this was the case, and this is going to be the case with a lot of different coronavirus claims. Now, this is the first time that we're seeing animals really test positive. They are expected to recover, but I can tell you this: my information, as always, is based off information from the CDC and the World Health Organization. Of course, they have the most up-to-date information. So as this virus develops, as it changes, information will change as well. So be sure to follow up with me about different things, and also be sure to keep up to date yourself. Do your research and send me questions if you have different inquiries. I know that some people were confused about a number of different things that changed. That we mentioned last week, Heidi, that now top health officials are requiring, or not requiring, are asking or recommending that you wear masks, and that was not the case before. So this thing is changing every day, and that's why information will change every day. So I know that a lot of people had different questions about that. I want to get to some questions right now. How far are they progressing with the vaccine, and how many nations are working on it? Jennifer, that's a good question. We've got a huge team of scientists working on this right now. Unfortunately, the timeline right now is still projected to be at least a year.
Victoria's asking, what's the difference between the two? I think maybe asking the difference between coronavirus and COVID-19. Let us know if that's what you're asking, Victoria.
Yeah, it's a very valid question. If that is what you're asking, Victoria, I can tell you this. The difference is, think of the flu. The flu is kind of, influenza is an overwhelming, it is an overarching term, an umbrella term for a number of different strains of a single virus. Now this is, COVID-19 is a certain strain of coronavirus. So coronavirus is the big umbrella term for a number of different viruses. SARS is one of those. COVID-19 is one of those. So it's a strain of a particular kind of virus, but it is a new strain.
And George is asking, what's the status on stimulus packages? Well, we know it's been approved. We're just now waiting. I think Americans are waiting for their checks. It's in that process now where the distribution is being planned out and worked on. And Chris, you can add to that if there's anything else we need to know about the stimulus package.
Yeah, they're hoping to get it to you by mid-month, I think, is the latest information that I'm hearing. I know that so many Americans right now certainly need this money. So what I can tell you is that they are working as fast as they can to get it to you. As for an exact date, I don't think we have one right now. I know there's a lot of questions about unemployment. I promise you I'm working around the clock to answer those questions, because certainly a lot of different people have reached out to me saying they can't get through to their local unemployment office, or they're having difficulty qualifying for unemployment despite the fact that they're out of work. So there's a lot of questions surrounding unemployment. I'll get to those later in the week as well. I do want to say a big thank you to Gladys for some kind words there. She says that she wants to thank us for our morning reports. I appreciate that, Gladys. We're hoping to keep you updated all week long.
Billy's saying, have we had an increase in Bell County? As of the weekend, over the weekend, we did not have any cases confirmed in Bell County, so the number stays at 58 cases right now. The Brazos County, of course, saw the most over the weekend. They had about 19 new cases. There's all the numbers on your screen for each county. But despite, it's a good thing we didn't see any new numbers over the weekend, but I can predict that we will throughout the week, because more people are getting tested. So we have to remember, it takes a while for symptoms to come up, and then it takes a while for you to get tested, and then it takes a while to get the results back. So it's a process, and that's why the numbers are going to be changing every single day.
Yeah, and this is what we're working towards, right? We're working towards flattening the curve. You hear that all the time, and that means essentially putting the curve down. So we want to tick downward in cases. We're not there yet, but hopefully we're progressing to there. Ryan, that's a really good question. If you guys can see it right there on your screen, let me do some research on that. I don't want to give you any information before I do some significant research and talk to the experts. So Ryan, good question. I'll get to that later in the week as well.
So continue dropping in your questions. I do want to get to our talker of the day, because it's an interesting one before we run out of time here. This morning we asked if grocery stores should switch to curbside and or delivery options only, and a majority of people said no, which was interesting, because we are trying to practice our social distancing. We are trying to make sure people are staying home, but these grocery stores are packed with people waiting to either get in or are inside doing their shopping. And so we asked that question this morning, and a majority said no.
Yeah, absolutely. So we'll see how that develops. Of course, we remind people they need social distancing. They need to follow these social distancing guidelines. Terry is saying something that we've answered a lot, but it's fine. That a lot of you can't tune in all the time. So they give the stimulus checks out, then they want them back plus the tax percentage on top of it. Terry, no, that's not true. What I can tell you is that this is tax-free money, which means essentially it will not be considered income, so you will not have to pay taxes on it, nor will you have to give it back when this is all said and done. Kathy's saying if someone owes child support and has a new wife and kids, will there only take his or her part or take it all? I think the new wife and kids should get their part. It's an interesting question, Kathy. We touched on it this morning. Even if you have a new, if you're owed child support, you're going to get that child support, despite the fact of your new status, and it won't affect your check either.
And Amber saying, I think it's important to keep reminding to stay home. Yeah, it's something we can't stress enough and can't say more than we do. I mean, we say it so frequently on the show, so just keep that in mind on this Monday morning. If you can, stay home. And of course, every single morning on the show, we like to give you a reason to smile. And today's story is so sweet. It's a man named Bob Kennedy who visits his wife 3 times a week at Levita Memory Care, only this time they can't be interacting, so they just wave to each other. And he drops off flowers for her every week, and they just say hello through the glass window there. And shout out to Levita Memory Care for still allowing him the opportunity to do this and visit his wife. So this is today's reason to smile.
Yeah, absolutely, Heidi. And I said on the show, I'll say it again, Bob told me when I did a story with him, he said, you just don't know what tomorrow is going to bring, so believe it when they say life is short. So let's all of us appreciate today. Let's stick together through this. Let's wash our hands. Let's stay at home, and we're going to get on the other side of this. We want to thank you guys so much for joining us here on Still Up with 6. Remember, this conversation happens every single morning, Monday through Friday, right after the show. And you can also watch us on Texas Today, 4:30 to 7 a.m.
And of course, you can always send your verified questions. There's Chris's contact information. Thank you again for joining us. We'll see you guys tomorrow morning.
Yep.